NHS and Odoo and some of our success stories. Representing Smart IT, I've been involved with Odoo since it was tiny ERP, and I'll talk to you about some of the backgrounds very briefly, and then I'll explain to you the two projects that I'm here to talk about, and then talk about some of the learnings and experiences along the way. Okay, so my background, I guess, before Tiny ERP and Open ERP and Odoo, I was involved in Sage Sovereign, integrating with e-commerce sites, and it was very difficult. It was very clear when I first saw Odoo, Tiny ERP at the time, why it's going to solve the problems, and essentially that's because of the ORM. And there's still, I don't think, anything else that matches Odoo when it comes to the ORM. So that's always been the case. Since this journey, there's been a lot of learnings, hundreds of Odoo projects, and I think really it occurred to me that the public sector would particularly benefit using Odoo, partly the opportunity for the open source angle, but just frankly because the current systems weren't delivering on what people wanted. So I made that my focus, and that's where I guess this story starts. So the two projects, one project is NHS England, was NHS Digital, now NHS England, and the other is the Royal Marsden. Both of these are actively using Odoo. Again, I'll get into the detail, but there's lots of commonalities between these two projects. Both of them started at the start of the pandemic from a delivery point of view, which was a very interesting time to start two groundbreaking projects almost in parallel. The journeys were both very collaborative with the customer. It was new, these things hadn't been done before, so it was learning for us, it was learning for the customer. Every aspect of it, I think, was new. And because of that, we decided to run case studies. And the case studies that we were running, we started from the start. We came up with a formula for case studies, which we've often used, which works very well. So that was what we created along there, which again I'm going to share with you. If you have a look at the pad that's associated with this talk, you'll see some resources. There's links to resources, case studies, other information as well. So do have a look at that along the way. So the first project I'll talk about is the Royal Marsden NHS Foundation Trust. What they were looking for is, they were very clear on their requirements, that it really mattered to them that they didn't have vendor lock-in. They had many previous systems through the estate where at the point that they put the system in, it was very difficult to upgrade, very difficult to integrate. And ultimately, as in every situation, that just generates lots of spreadsheets and therefore lots of human time. So they were very keen to not have that lock-in and to be in control of what they were doing. Integration with other applications was really important, particularly integrating with the bank so that they could automate some of their transactions. They wanted to run this organization with very few people. It's a subsidiary organization, and so they wanted as much automation as they could have with as few people as they could do. And again, that lends itself very well to Odoo. And they needed a fast delivery on this because of the timeline of their project. They were very sensitive with cost escalation, lots of experiences in the NHS of projects overrunning, public sector projects overrunning, or where the vendor will just keep asking for more money. These are the common stories which they wanted to avoid. So they had some key objectives of the project. It came down to the staff productivity, and that's automation of the standardized processes. On paper, the processes were pretty much standard. It's whether the digital system will allow these standardized processes to be operated in the way that they wanted. They did have existing ERP systems within the organization, and they understood what the limitations of those were. Value for money was really important for them, and that can be measured in many ways. And again, there's lots of negative experiences with finance systems. Many stories in the news all the time with the NHS and public administrations with finance systems and ERP systems that don't really deliver what they should do. So that was the key objectives. What they were looking for was the suite of functions for the NHS, so general ledger, accounts payable, receivable, fixed assets, cash management. They were the key finance functions. And they also required some data transfers, being with the pharmacy point of sale system. That was an incumbent system that runs the pharmacy. Pharmacies are rigorously regulated in the UK, so it wasn't appropriate for us to see if we could put the Odoo point of sale in there because they had an established incumbent. It was really about how we can interface with it. The RBS, and also the other change that happened around that time was the UK tax authority introduced a system called Making Tax Digital, which was also coming online and becoming mandatory around that same period. So there was these functions, plus all of the existing functions that they expected from their previous systems as well that they wanted in there. So the customer journey was that they were evaluating the marketplace with their requirements, and particularly the open source aspect to them was very important. They weren't able to identify many ERP systems that had the functionality and were able to be delivered against these requirements. Some of the existing challenges they had, I should say, with the existing system, there's a system that's used by many, if not most, of the NHS, and it's based on a proprietary solution. There's some challenges. For example, it takes around 24 hours to draw up a trial balance, so that can be a challenge at the end of month where you input your numbers, you want to have a look at your trial balance, see what it is. If you've got a problem, you have to edit it, and then you have to wait a day before you can see how all the numbers flow through, which sounds a little bit, in the modern day and age, unbelievable, and especially in the kind of Odoo world, that would be true. But actually, that's the case with many, if not most, of the people in this market. So that was one of the current challenges. There's many other challenges with integration, and as a result, many operations became spreadsheets. They just didn't have the budget to hire the people to run the spreadsheets. That was a real benefit to have that constraint, for them not to be able to do that. So as a result of this, we created a white paper that covers the details. Again, this is on the Odoo, on the pad that you can have a look at. There's a list of the different challenges and how they were responded to. So yeah, there's a huge opportunity here. We put in a really simple Odoo in this particular project. Because of the pandemic, because it's a new customer, they hadn't used Odoo before, we wanted to put in a most simple challenge. Just we come back in. Okay, so procurement was interesting. With procurement, we had a challenge that they didn't know how to buy open source. That was the main issue there, and as you can probably imagine with the public sector, there wasn't. I mean, the whole point of buying open source itself is an interesting idea. So we had to work with the existing frameworks and find ways. Fortunately, a few years beforehand, we decided to publish Odoo within one of the government catalogues. So we were able to kind of integrate this project with the existing procurement links. But procurement is a real challenge, and a lot of that is around the understanding of the customer. And in addition, the procurement teams don't really understand how the whole open source thing works. So there was that. And then the other thing was the delivery. And the way the customer was very busy. Again, there's a pandemic, but other things as well. So we had to really carefully consider how to deliver this in the least disruptive way, to deliver this subsidiary. And it was a new subsidiary as well. So there was also that going on. We created videos, we created a very simple step-by-step training information to help them do what they were doing there. As an outcome, they had direct savings in this first 3 years in the measure of hundreds of thousands. Yeah, it's okay with my going to sleep screen. So direct savings in the first 3 years of hundreds of thousands. Another outcome of this, because the impact of this was successful immediately, there's a client-recorded testimonial video on YouTube, and this is probably about 30 minutes of the finance director explaining the difference this has made to the organisation. And actually, his story is that this is something that should be repeated across the NHS. It should be that now they've made this investment, that other organisations should be able to take this and build on it with the support of Odoo partners in the UK. The next thing that happened is that NHS England, we were also working with NHS England around their open source policy. NHS England then released a playbook. So if you search Odoo NHS, you'll see NHS England's website has a playbook that describes this as a recommended solution for innovation in finance. And then we also the project received recognition by the NHS Finance Forum, the group of 200 or so finance directors who reviewed this case study and reviewed this project and awarded it an innovation in finance. So it was the first open source project that received that, based on the delivery and the outcome. And it's important to say this is all about delivery. This wasn't a marketing first activity. This was all about get the job done, get it delivered. And these amazing endorsements were the result of that success. So that was the Royal Marsden. The next one we will look at is, just excuse me why, is NHS Digital. Now NHS Digital, for me, was one of the most exciting projects. This was something really Odoo worked really well for, but I think it stood out more than probably any of the other Odoo projects that I've been involved with. What the problem that the NHS Digital had, they had a framework, and their framework is the system that allows GPs to buy software to rent. So it's like an app store for GPs to use software. There is 6,500 GPs. There's around 200 products and around 70 suppliers. So that's quite a large, if you times those together, that's quite a big number. So that's the size of the marketplace. And what they need to do is to send bills to the customers for each line of software being used, and so that the suppliers can get paid. And the payer is neither of those parties. The payer is NHS England. So we had quite a complex situation. NHS England paying a bill for software consumed by a GP, supplied by someone else. And each life cycle was different of every line. So if a GP was using 4 pieces of software from a supplier, they might start it on different days. They might have it for 1 year, 6 months, 5 years, all sorts of different time periods. So if you think about every item line is unique across all of these different scenarios. This was all managed in spreadsheets manually. So it took them probably, quite some time. We're talking weeks, if not months, to get each item line right. And they described that they needed a small army to process this data. So that's the complexity of what they were trying to do. They really wanted to move away from these spreadsheets. They wanted an integrated system because as an outcome of this, they have to pay those bills and the suppliers need to know what they've supplied and the customers what they've consumed. One of the key pieces we identified earlier on with this is that the essential requirement is that a month, for example, is not a unit, but it's a period of time. Now that's quite significant thing to consider, is a month is not a unit. You can't have 1 month or 0.5 of a month because half of January doesn't equal half of February. You have to have a time period. So all the maths are based on time. And that added a further dimension of complexity. We'd prototyped time-based systems for the last 20 years, so it wasn't hard to understand how to address this, but we had to consider how we could address it at this scale of every GP in the country. The data had to be right. You can't get these things wrong. You can't have a line where somebody's overcharged or undercharged. So that was one of the challenges. So we were approached by the NHS to try and help them understand this problem. Procurement was difficult again because they didn't understand really how to buy such a thing, and it wasn't quite bespoke and it wasn't quite on the shelf. It was a blend between the two. Again, pandemic. We started this at the start of the pandemic. Timelines were tight. They had an urgent deadline, as always the case. And they had an existing program where everything was processed through spreadsheets and sent by email. So somehow we actually had to downgrade what we were doing to also work automatically, but allow them to manually send emails with spreadsheets. So that was the kind of lead up and the customer journey, the requirements. The outcome in this particular case is that within, I think, 3 months we delivered the MVP, and then further 3 months the things settled down. Of course there were bumps, it was complicated, there was a lot of change management and human challenges along the way. But then we got to the point where it started working, and the last time I looked, it processed 4 million item lines, something like that, without errors. The problems we had were generally around the outside of the system, bad data going in, then obviously it doesn't add up correctly. So therefore, we're looking at the next phase, which is self-service. If we can remove the spreadsheets and make more of a self-service system, then we're going to improve it even more. So that's the next part of this. It saved thousands of hours. This is the description from the NHS, that thousands of hours saved of doing this. And the reality is that it's also not only directly saved thousands of hours, it's opened up the marketplace to new suppliers. And the reason for that is because being a supplier to this original system was actually quite expensive, a lot of administrative overhead. This actually opens up the market to new suppliers, making it more competitive, and overall drives more value to the NHS. So again, this was recognised by the NHS Finance, one NHS Finance, and was a second Innovation in Finance award for this, and also the ACCA, which is the Association for Accountants in the UK, awarded this the CFO Tech of the Year. So there was another very positive outcome. Very successful project, and it's got a long way. This is just the start. There's a long way to go. So just in considering both of these, just reviewing where we are, some of the key success factors here were mainly the team. It was the team who delivered this, the team who had to understand some real complex situations around the problems, around the fact that there's change management, the customer had never done this before, dealing with procurement, where the procurers haven't really bought in this way, this kind of thing, trying to avoid politics. With all of these organisations, politics creeps in, and it's really about delivering anyway, irrespective of politics, and the perseverance and tenacity to push through. So I think if anyone is in the situation of working with public administrations, NHS or across Europe, then it's really important to deliver anyway. There's always an excuse for something to go wrong, and there's always someone who'll prefer it not to work, and they can say, yeah, it failed, and I was right, it failed. You have to deliver anyway. I think that's a really important piece, no matter what else is going on. NHS is different to EU organisations, but also there's a lot of similarities. Some of the benefits of working with the NHS is the project management. They do have the resources. Many small businesses don't have the project management resources. The NHS do. It's important to match that internally. They are experts in their fields, and that must be respected, but they're not experts in your field in delivering ERP systems. So there's a balance to be struck there. This is where the collaboration is important. And when they're properly engaged, they do listen and they do work collaboratively. You have to solve every problem, even if it's not your problem. If you're working on a project and something gets in the way, again, the politics you have to be careful of, because it could easily be seen as your problem from someone else if it's not their problem. So make sure you solve every problem and drive the project. Make everything as simple as you can make it. That simplification is important. Move sideways. One can easily look at these public sector projects and think, well, there's so much we can do here. But it's important to not try and do everything. Do as little as you can. You'll deliver huge value by moving them sideways, and then you can build on and iterate. If something's too complicated, the change management is too difficult, and certainly in health, every professional has other things to think about. They're saving lives, they've got pressures, financial pressures, they've got all these other things. So it's really important to keep their overhead as small as it can be. Having strong project management is important. De-risk the customer. Think of what might trip the project up. And again, it's not just looking at your own timeline, it's looking at the whole project. Make sure the customer's committed to the project rather than it being someone's idea and they're not fully engaged. If they don't really come to meetings and they're not really bringing resources, that's a red flag to know. Marketing is really important, but marketing academically based on fact. It's not a marketing opportunity to say how great everything is. This is about communicating the fact this is a really strong benefit, it's a really good outcome, and it's making a difference. That's enough to communicate these kind of things. There's never enough budget. That's another thing. And you can always go and have a look on the internet for the tree swing project management picture. There's a really good illustration there of how every public sector organisation, well, probably every organisation thinks. Make it really easy for the customer, training videos, that kind of thing, and hold their hand. With this kind of change, with the 2 projects I've explained today, and with any public administration change, don't underestimate the shift they're making. You may be putting in another Odoo, but they are making a cultural change. They're making a seismic shift. And thinking of this scale of project, it is also a generational change because, okay, these are 2 and they're quite significant in the NHS, but we're just at the very start of this journey. This is the start of the NHS journey for Odoo. The market is worth around, looking at the current spend, we're measuring it in billions, the current marketplace. So there's huge opportunities there. So that's where we are. What I'd ask you to do is to just think about how you see opportunities in your public administration, how you can see how Odoo can solve problems in your area, for your health service, for your national systems, be part of the story. Let's continue the conversation. Come and see the stand, Smart IT, just by the door downstairs. Come talk to me. And go and have a look at the pad. Again, resources on there, all of the things that you need. And I'd love to hear your questions. Thank you very much.
Do we have any questions from the audience?
Was it fixed rate or time and material, and how did you handle kind of the financials of the project? Were they willing to pay for MVP ahead of time, do proper ROI?
Mm-hmm.
Can you talk a little bit more about the finances?
Yeah, of course. Yeah, of course. So they don't want to pay time and materials, fixed price. And so you can imagine the challenge that they're effectively saying, can you deliver a thing that we can't really describe to you and we want a fixed price for it and we want it in 3 months? Now, I don't want to kind of make it sound like they were somehow difficult or bad or that's just how it is. So you have to be very creative with the finances and with the procurement here. What we had to do is take a judgment as to, we had to come to a view of what an MVP would look like. And be really clear of the scope. What does minimum mean? What does viable mean? What does product mean? Really define those things in detail. We came up with a budget, and the budget was based on what do we know we need to make sure this is going to work, and let's make the scope so that we can manage the creep. But there's a lot of flexibility in there because the customer couldn't describe exactly what they wanted. The way we approached it then, with this minimum viable product, was to start off with analysis. The first probably quarter of the project was just thinking. You know, we weren't starting to write any software at that point because that was the worst thing we could do, is write software. It's like building a house. You don't build it and say, did you like it? You have to get that architecture right. So we pushed back the delivery as long as we could to do the thinking and try and rattle out all of these challenges. And again, with this experience of time-based billing, we were in a position to understand what are the different categories of how does time-based billing work and how do products work. So that was how we managed the commercials, is by us effectively leading it and describing to them. And there was also a certain trust here because we were working collaboratively with the customer. And this is, again, key. I'm talking commercials, but the reason we didn't go back to the contract was because we delivered. And that's the other thing, is if we hadn't delivered, we would have gone through the contracts, and the contracts for the divorce, not the marriage, as it were, and you only get to that if it's gone wrong. So it's really important to work within the commercial boundaries, but that creativity to have enough flexibility to deliver it. So it was fixed price. We also focused on further phases, so we created a roadmap project. We have now, next, and sometime, and we really focus on this is now. And when the customer says, oh, here's a great idea, it's about saying, okay, lovely idea, we'll take it and we'll put it on the next, which is your next project. Because otherwise they just want it now, otherwise they feel that they can't remember it if they don't have it done. They want to say, remember it by writing it in the software. So we have a process of remembering it by putting it on a roadmap, and then they kind of let it go and say, okay, I'm happy you've got it, that you can do it, let's move on. So removing these blockers. A lot of culture, a lot of that kind of thing. Yeah, and then the ongoing contracts as well need to be very finely tuned from a support and maintenance point of view. I'm being quite vague here, but there's a lot of detail, which I'd be happy to talk about afterwards if that would be useful.